Hi, I'm Dr. Steve Myers, and I'm here with my patient Ernie, who is 3 months out from a bone marrow stem cell procedure for some arthritis in his knee, a medial meniscus tear, in addition some bone marrow lesions on his MRI imaging. Before we talk to him, we're going to take a quick look at his imaging studies. Okay, so taking a look at his x-rays, this is a standing x-ray looking at his right knee, and you can see that he has good amount of thick joint space on the outside of the knee. However, on the inside of the knee, he has some notable loss of space and a mild bone spur on the inside of the knee. Bone spurring is part of arthritis. Switching over to his MRI imaging, on these sagittal views, this is looking at the lateral compartment of his knee, which is normal, and he has nice neutral gray color to the bone, and his meniscus cartilage is well formed and dark in appearance. As I scroll through to the other side of the knee where his problem is, you see these bright areas of swelling. This is fluid in the bone. We call these areas bone marrow lesions, basically arthritis within the bone itself. Also, he has this white defect in the back meniscus triangle indicating a tear. Switching over to the coronal images, here's his kneecap up in the front of the knee, and as I scroll back through the knee, nice normal looking bone color. This dark gray is normal looking bone. As we keep going back, we get into this bright area in the tibia. This is swelling in the tibia, along with bright areas occurring in the femur here and both sides of the joint. These bright areas indicating basically arthritis in the bone itself. When a patient has these bright areas of injury within the bone noted on MRI, it is not sufficient to address the joint and meniscus alone. You have to address these bone areas of injury directly with injection. So these are fluoroscopic images from procedure where we are directly guiding a needle into the bone to inject the bone marrow stem cells. So here you can see the needle coming into his medial tibial plateau to inject this area where he had swelling on his MRI. And we also injected into his femur. Here's the needle coming into the femur, and we advanced the needle even further. I know this image is a little bit fuzzy, but we advanced the needle right into the middle of his medial femoral condyle to inject into this area of bone lesion noted on his MRI. So let's go back before treatment. What kind of issues were you having? What brought you into me?
Okay, I had originally a stem cell procedure, and it had been, I guess, was it 3 years, doctor?
Something like that.
All right, and it worked pretty good, and then I started doing a lot of lifting, remodeling a house, activities that were just, I think, were not good for my knee, and I started having really bad pain in it, to the point where I quit working out, pain in the evenings, sitting on the couch, pain and sleeping. I just didn't want to do anything.
So we ended up getting an MRI.
Yeah.
Showed that you had new injury, meniscus tear in the knee. And so what kind of issues were especially difficult prior to treatment this time around?
I just remember the pain being really significant, like here my femur and the tibia and right here on the inside. That's where I noticed it. And so much so that's why I came back to see you.
And so what kind of activities were especially difficult with the knee?
Definitely carrying stuff, going upstairs, couldn't run. If I just thought about running, just made pain think. It just brought idea of pain to my brain. So that and long walks. I'd gone to the state fair last fall, and it was terrible. I wanted to get out of there about 30 minutes. I couldn't stand walking around.
So tell me about the procedure, the day of procedure. Do you remember much? How was the pain? How was the pain the first day or two afterwards?
No, the procedure was easy. It was kind of funny, actually. I had a good time. It was in and out quick. That evening, maybe a little bit, but nothing like I've had both knee scoped in my one in my 30s and one in my early 40s, and it was nothing like that.
Nothing like that. Okay.
Maybe a day I took some pain medication, and the next day I was off of it.
How quickly after procedure did you start seeing some improvement with your right knee?
I think immediately I noticed that first week, within that first week, I did not feel the pain that I told you about in the bone, in the joint. And I was wearing the brace, obviously, but even when I take the brace off, I didn't notice it. So just it was incredible. I was already bragging about it to friends. I was like, I can't feel any of that pain anymore.
So here we are 3 months down the road. How are you doing?
I'm doing excellent, yeah. The only last hurdle I had was my physical therapy, to where I could get to that position where I could just get up out of the chair and not feel like my knee was going to give out, you know. And that's gone. Go up the stairs, same thing. So yeah, it's really great.
And with your knee, do you feel like you made the right decision with your treatment?
Yes, yeah, it was the right thing to do.
So before I let you go, let's demonstrate a couple activities with this knee,
Okay.
see how it's doing. Okay, Ernie, can you get up from that chair on your right leg only? Good. Pain today?
No.
Good. Let me have you do one more thing here for me. Come step behind this step here for me. And can you stand up on your right foot first, up the step? Good. And back down. Pain in the knee?
No.
Good. One last thing. Hold my hands. Stand on your right foot only. Good. Now bend that knee a little bit. Good. Now spin your hips to the left and the right. Pain to do it. Pain in the knee?
No, that would have hurt. That would have been.
Well, thanks for coming in and sharing your experience. I really appreciate it.
Yeah, thank you very much.
All right, man.
Take care.